program from his healthcare law because they say there's no way to pay for it.
Joining us right now is former New York State Lieutenant Governor and healthcare expert Betsy McCaughey. Good morning to you.
Good morning.
All right, we're talking about the Class Act.
Here it is.
That's the whole healthcare.
The Class Act is a small part of this monstrous health law. It's right here on page 710.
And what was the Class Act going to do?
Well, it was going to provide long-term care. Medicare pays for seniors when they go to the hospital or go to the doctor, but if they need long-term care, Medicare only pays for a few days. So this was a voluntary way that workers could take some of their payroll, put it into this system, and then later in life, they'd have long-term care insurance. But from the beginning, it looked like a house of cards, and in fact, lawmakers were warned before this law was passed that this would not work, that the money wouldn't be there.
Right.
There wouldn't be enough money. And it appears that right from the beginning, it was a gimmick to help this controversial bill squeak through Congress on Christmas Eve. It did, because when a big bill like this is proposed, a federal agency called the Congressional Budget Office is supposed to tell lawmakers, is there enough money coming in under this law to pay for what's going to go out? In this case, hospital bills or nursing home bills. But they only have to tell them for 10 years.
Right.
And the way this was written, in the first 10 years, premiums would come in, but nothing would be paid out. So it looked like, wow, $700 billion, right? Excuse me, $70 billion in deficit reduction over the first 10 years. But of course, it's disappeared because this is not going to be put into effect.
And the key for this is that if this was supposed to save enough money to finance other parts of his plan, where is this going to, now that it's gone, what happens?
Well, that's the problem. The super committee, which is meeting right now to figure out how to reduce future deficits in the United States and put our fiscal plan in order, they're going to know that this Obama health law is not saving money in the first 10 years. That's just disappeared. So it's part of the problem, not part of the solution.
And you say now that the government has officially said, okay, that Class Act part, that's not going to work, we're taking that out. You say this is just another sign that the entire health care bill is unraveling.
Well, it is unraveling. First, we had the waivers, 1,470 waivers to companies that said the early provisions of this law are so costly we can't possibly. Right. Now we've got the Class Act.
Gone.
They've canceled it, right? They'll have to actually repeal it. It's like a loaded gun sitting on the table. And now we hear that the insurance exchanges that are supposed to be set up in every state by 2014, because people will be compelled to buy health insurance, many of them on that exchange, we hear that's not on schedule either.
Oh, unbelievable. So this could be devastating, and you just wonder, too, if the president doesn't realize that, and is that why he's not running on this? He never talks about health care. You don't see that being in the Democratic platform or an accomplishment.
This law is as unpopular now as the day it was signed. The public outrage is growing because it lowers your standard of care. It puts government in charge of your care. And it takes away something as precious as life itself, your liberty.
Right, and it's paralyzed a lot of the healthcare industry because they don't know what's next and how it's going to affect.
All right, we're going to get a forklift over here so you can haul that out of the studio.
All right, it's big.
Betsy McCaughey, thank you very much.
Thank you.
Thanks, Betsy.